Morning with the U.S. adding a second COVID-19 vaccine, a dire warning from one of the states needing the vaccine the most, Tennessee.
We're the highest state in the highest country in the world, and so it's not the place that you want to be.
Dr. Stephen Threlkeld received the Pfizer vaccine on Thursday and says the Moderna version can't come soon enough to the rural communities they serve.
Getting into smaller towns and to rural areas will save countless lives.
Health experts say the Moderna vaccine will be easier to handle.
It can be stored in a regular freezer. It can be stored even at room temperature for a few more hours than the Pfizer vaccine. So while both are safe and effective, we are grateful to have either one.
The vaccination campaign began last week. This tracking map by Bloomberg showing which states are getting the most vaccines. The rollout, a huge logistical undertaking across the country.
We appear to be on the cusp of emergency use approval of two very important vaccines from Pfizer and Moderna. They've shown to be extremely effective, far really beyond our expectations, and really quite safe. It's going to be very important for us to take them. It's been many times, vaccines don't save lives, but vaccinations do save lives. And so if we wait for herd immunity, which is about 70% of the population, to get infected to give us that immunity, we'd lose millions of lives in the offing. And so it's going to be important for us to get those people immune by vaccination. If we do that, you'll be less likely to be around someone who can get the virus because they themselves are immune, and therefore they can't give it to you. That'll protect us, those who get the vaccine, and it will protect those elderly and high-risk people around us who may not have even gotten it yet. So spread the word. It's a safe and effective vaccine from everything we have seen in the data, and it'll be available soon. And we need to get it to save our own lives and the lives of so many people around us.
With the vaccine now, and when can most of us get it? Well, right now, the CDC guidelines are being followed by essentially all states, and that is that the frontline healthcare workers and those who are at the highest risk of contracting the disease and dying from it, that is residents of long-term care facilities, are in group 1. After that, the states do have the capacity to change the CDC guidelines and make their own rules, but in general, it's going to follow the line of decreasing age, because that decreases the risk as we go of contracting this disease. And then also putting in frontline workers, essential workers to society, ranging from firemen, policemen, and including teachers and other things that are really essential for us getting society back to normal. We hope that by the spring and early summer, most people will be able to get this vaccine in sort of an open season. That's when we're really going to get the relief from this and get life back to normal, we hope, by late summer or certainly by fall.
Is the new coronavirus vaccine safe? Has it been developed too fast, and thus is it not as safe as vaccines before it? It turns out the new messenger RNA technology takes weeks, months, or longer out of every stage of development of these vaccines. We don't have to grow up virus, make modifications to the virus, and then grow it again, time and time. And this can save a great amount of time at every single step of the development. It got to clinical trials sooner because of that, but those trials themselves were not rushed. We had to wait for people to be infected and to decide which group, the placebo group or the vaccine group, was safer and more effective. Turns out 95% of the people that were infected were in the placebo group. Therefore, the vaccine group was really well protected from infection, with really a minimum of side effects, none of which were particularly severe. So this will allow us to move forward in a kind of a plug-and-play technology to even move on to other viruses and other pathogens in making vaccines to save lives from other diseases as well to come.